There is a lot of shift and a lot of focus right now on the vaccines that are available for COVID-19. We are hoping, because it was about a year ago this week, that our country started shutting down due to this virus, but now the focus and the hope is on the vaccine, but there's a lot of questions between the vaccines. Which one should you get? So to join us now and talk a lot more about this, let's bring in Dr. Russell Faust. He is the medical director for Oakland County Health Division. Always great having you with us.
Good morning, and thanks for having me.
And I will say happy Monday, and it looks like it's going to be a beautiful spring day.
Yeah, and happy COVID anniversary, or not so happy as it turns out. So, but yeah, a year now.
So was it a
long year?
It's been a very long year, and if we only knew back then when they talked about shutting things down for 2 weeks to flatten the curve, if it was the different decisions we all would have made, right?
Yeah, we've been fortunate actually to live in Michigan because I think the public health officials did a very good job, better than most states.
So I know a lot of the focus right now is on the vaccine. And of course, today, the big news is people that are 50 years and older that have pre-existing conditions are now eligible for the vaccine. What are your thoughts on expanding that when it seems like there's still an issue in trying to get others prior to this group vaccinated? Is it just going to bog down the system?
Yeah, I was listening to your chat before the break, and I appreciate your comment that just because you are now listed as eligible doesn't mean you necessarily have access to vaccine. And that has been an ongoing frustration for us here in Oakland County Health. But when I look around the state, there are actually health departments in some very small jurisdictions, small populations, who really pretty rapidly kind of move through their 1A and 1B, eligibility categories, populations, and they're ready to move on. And I think so the state MDHHS helps them out and says, let's open it up so that they can, legitimately or legally go ahead and vaccinate those folks. We here still have something like 300 or 400,000 people on our waiting list, which, seems like a lot, but let me qualify that by saying a lot of people treated it as though it were a lottery. And so many people signed up like 10 times thinking that would increase their chances of being called up, and it just doesn't. So that 300,000 or 400,000 on the list includes a lot of duplicates, or I should say multiples.
So with that, too, I was wondering the other day, because I had a friend who was able to actually get the vaccine in Detroit because of his employment, but is on the list. Is there a way for people to remove their name from the list? Will that help out the process and your team back there?
Yes, and so I'm glad you asked. Thank you. So the way to get on the list, let's talk about that first. Is to go to oaklandcountyvaccine.com. Not vaccines, but oaklandcountyvaccine.com. Click on the big blue button that says Save Your Spot. That'll get you on the list. No matter who you are or what your eligibility is, you should do that now. The sooner you get on the list, the better. Then when your eligibility population comes up, you will be contacted when we have adequate vaccine. And you should, but if you're signed up on multiple lists and you get vaccinated someplace else through one of the pharmacies or your healthcare system, your hospital, please come back and go to oaklandcountyvaccine.com. And I believe it's the gray button that says remove me from the list. And let me emphasize, people should sign up on multiple lists. They have access to various hospital systems, pharmacies, as well as Oakland County. And historically, we've received kind of the minority of the amount of vaccine that's been distributed in county. Of, more than 250,000, I think 300,000 or 400,000 doses that have been administered in Oakland County, we've been less than a third of that. So, you have a better chance getting vaccinated by your hospital, for example.
Yeah, so that's a good thing to know for people. Remove your name. Make it easier for you and your team back there to get through that list as well.
We do spend a lot of time kind of, vetting the list, kind of weeding through it, but we're getting through it.
So how does it work when we're talking about eligibility? Who is checking that? Or is it kind of an honor system?
Well, I mean, obviously, if it's an age-limited eligibility, 65 and up, you have your driver's license or ID that has an official date of birth, that makes it pretty easy.
Yeah.
And honestly, beyond that, beyond kind of the age brackets, we're not really requesting proof. Now, if you need to be a healthcare worker, obviously you have a name badge for your healthcare system or your doctor's office or wherever it is you're working. Those things are easy. But issues such as, I have chronic heart condition or kidney condition or diabetes, we're not asking for a doctor's proof that you have these things. And, honestly, between just you and me, all I care is that we get vaccine into somebody's arm. We just need to vaccinate more and more people. So really the frustration or the limit for us is not adequate vaccine. And, when I look at, so a couple things people can do. They can go to oaklandcountyvaccine.com and scroll down and look at the doses we've received and the doses we've administered in arms. And that's in a table there. They can also go to oakgov.com/COVID/dashboard and actually look at case numbers, and those two sites will give you a really good sense of what's going on in Oakland County. But early on, we received fewer than 2,000 doses a week. 2 weeks ago, more than 18,000 doses. Last week, more than 20,000 doses. So, things are moving in the right direction. More doses are being received across the state, across the nation, and nationally, I think we're doing very, very well. I think we're over 2 million doses a day being administered right now nationally. So that's where we need to be.
Dr. Russell Faust with us here on the MegaCast. He is the medical director for Oakland County's Health Division. We have to talk about the differences in the vaccine because,
yes, please.
And one thing we're used to in America as consumers is to be able to pick and choose what we want and what we don't want. But in this case, really you have no choice. It's go get the vaccine. It doesn't matter which one is available.
Thank you. But yeah, even when all we had were the 2 mRNA vaccines, which are virtually identical, they both code for the spike protein. Even then, a month or two ago, I was still getting people in line that would insist, they were brand shopping. They were insisting on one or the other, the Pfizer or the Moderna. And we're still getting that. And as we move forward with the Johnson & Johnson or the Janssen added to, our available vaccine, we're going to have more of that. I urge people not to brand shop. If you get called, if you receive the email to be vaccinated, please just get vaccinated. I mean, honestly, if it were up to me right now and I were not already vaccinated, what's not to love about a single dose? I would just get the Johnson & Johnson. And let me emphasize this. People are hearing or reading these numbers of success rates or efficacy between the various vaccines and comparing them. You cannot compare clinical trial results that were just run recently to clinical trial results that were run for Pfizer and Moderna a year ago. The various variants did not exist a year ago. And now the Johnson & Johnson clinical trials have been run in places like South Africa or Brazil and the United States when we have variants that are just rampant in the community. So those numbers, they're comparing apples to oranges. They're safe, they're effective, just get vaccinated.
What about the news that's been coming out recently, obviously, about some of the religious leaders in the Catholic faith telling people if you're going to get vaccinated to choose one or the other? Why is
And
that? What are
certainly-
your thoughts about that?
Yeah, certainly, I respect that, and we have to respect religious practices and religious beliefs. And certainly there will be people that don't want the Johnson & Johnson or prefer to get the Pfizer or Moderna, and may tell us that they need to do that on the basis of a religious belief, and that's fine. We're not going to be asking for proof of religion. But I will say this: we have been pleasantly surprised over the demand for the Johnson & Johnson. I mean, I've been quite surprised. I expected there to be a little bit of resistance to the Johnson & Johnson based on the numbers that we see in the media. And in fact, we're out of it. We received something like just over 7,000 doses, and they're all spoken for now, which I was surprised at, frankly. That's a good thing.
Yeah, it's one of the things I'm interested to see how it's going to play out as the vaccine becomes more widely available and distributed through various entities, such as some of our pharmacies and other arenas and areas, because the Johnson & Johnson doesn't need that, super cold freezer for it to be stable. So it seems to me that that's going to be a safer one to put in people's arms, because the more people that put their hands on this vaccine, let's just say that you can't always trust people in doing and following the proper procedures and protocols.
And that's a great point. I mean, I think it's a little more reliable now. And I think that's why there's been such demand by our various partners. We've now become a distributor of vaccine in Oakland County. And we have been sharing and supplying our various partners, our hospital systems, Henry Ford and Beaumont, the 3 or 4 hospital systems in county, as well as private groups, agencies, organizations, the Honor Health, Community Health, for example. And the Johnson & Johnson has been very popular just because of the logistics, the ease with which it can be stored and administered.
Right, because if we're going to start doing them, I know in Detroit they've started reaching out to some of the churches as well as some of the community centers. But if, the Pfizer and the Moderna have to be kept at those super cold temperatures, you're not taking in one of those specialized freezers to the community center or the church. So how is all that working, or that's part of the discussion as you're distributing the vaccine?
That is part of the discussion. In addition, last week, CDC came out with a policy adjustment that the Pfizer vaccine can be treated exactly as the Moderna is. So we no longer need the super cold freezers, the -80, -90 degrees Celsius. So that does open the logistics somewhat. But in fact, the mRNA vaccines, because they're based on RNA, are certainly a little bit more fragile than the DNA vaccine of the Johnson & Johnson and the AstraZeneca, for that matter.
Explain the differences again.
So very quickly, the mRNA vaccines takes the codon or message RNA, wraps it in a lipid nanoparticle, and they just inject that into your arm. It's taken up by your cells, and your cells use that to translate it into protein. The Johnson & Johnson is based on getting a DNA copy into your cells, and it adds one more step. So that DNA then needs to be transcribed into RNA, and then from there, it's identical to both Pfizer and Moderna. That is, it's translated into protein, spike protein spit out. So it adds one more step in the cells, but the DNA is certainly more stable than RNA. RNA is fragile. Because we have evolved with many RNA viruses, our bodies are full of enzymes that chop up RNA, and it doesn't last long.
So if we can take a moment to talk about COVID-19 testing, because we are seeing the numbers go down quite a bit. Is that because not as many people are getting tested right now?
That's a great question. And certainly that's one reason, but I will point this out. If we look at the important number there of those people who are getting tested, the number that are positive, that number is also going way down. And so what we really were being told by World Health Organization and CDC early on in the process is that to minimize transmission through the community, we want that positivity rate to be less than 5%. And we're well less than 5% right now. We're somewhere around 3%. Now, where you want it depends on how easily it's transmitted. And now that we have variants starting to be common in the community, certainly I like that positivity rate to be 0, but it's certainly down, and that's reassuring.
So now it's like not only are we fighting COVID-19, but now it's the news about all the variants, like you just mentioned. We are, for so many of us that are in the public, we're not medical people. We don't have your expertise or your knowledge to break it down. So we like to kind of associate it to something. So the easiest thing is to say, oh, it's like the flu, and it's a new strain of the flu. And the vaccination doesn't always work against that strain, but you still get vaccinated. You still get your flu shot. Is that a fair comparison?
To a certain extent, it is. In this way, it's a fair comparison. Both are RNA viruses. And because they're RNA viruses, they mutate fairly rapidly. That is, when you get infected and they make a copy, the virus makes a copy of itself, it doesn't do it with great fidelity. It doesn't do it 100% accurately. And so every time it makes a copy, it makes mistakes. So that results in variants. Influenza does it at a phenomenal rate. So over the span of a year around the globe, there will be 1,000 or more variants of influenza that come up. And so when they make the influenza vaccine, CDC and World Health Organization look for the 4 worst, and they make a vaccine against those. What we're seeing with COVID is for people who are infected over a long period of time, those variants begin to accumulate, and those become a problem. The ones that are out and become a common strain become more prevalent because they're more easily transmitted. That's what their variant does for them. Fortunately, all of the variants right now are still sensitive to vaccine immunity. So that's all good news. And it will take many, many, many mutations for them to become resistant to vaccine-based immunity. So far, so good. But what this means is that we're frankly in a race to get as many people vaccinated as possible before a resistant variant pops up.
That's good to know. I think you're the first person I've heard put it like that, and it breaks it down for the general public, because I would imagine a lot of your time for you and members of your staff trying to re-explain so much of the disinformation that is out there in the public. It has to be a bit frustrating. So is this something like, should we anticipate that we're going to need a booster shot, or just like you get the flu shot every year, you get a COVID shot?
It's a great question. I don't know how many times a day I get that question now. Right. I honestly can't predict, but again, I will say we're in a race. Right now, I'm cautiously optimistic. We're vaccinating people at a great rate right now. I think if we continue like this, we will beat the time when perhaps a resistant variant does come up. I'm hoping that we avoid needing boosters. And I think at this rate, we might need a booster. Here's the other issue. Even if we get everybody in the US vaccinated, there will be countries out there that are not being vaccinated. Mm-hmm. So let's say countries in Africa that are not being vaccinated, and those folks are going to be getting infected with COVID-19, and as they're getting infected, new variants will be coming up. So a year or two from now, one of these variants is going to come back around the world, and we will no longer be immune to it. And that will be a problem. We need to get everybody on the planet vaccinated to put an end to this pandemic.
So it really is a global issue, and it's a reminder that we are all in this together. I mean, literally, we are all in this together, but we do still have a huge portion of the population. They do not want to get vaccinated. But do you think we're going to get to a point to be able to go places and live life like we used to know it? You're going to have to show that you were vaccinated.
You know, what I tell people in the vaccine clinic is to take a photo of that card that has their vaccine sticker on it, so they have it permanently saved in their phone or in the cloud, because I fully believe that moving forward, proof of full vaccination will be your passport to participate in all sorts of activities, whether that's travel or go to a restaurant or what have you.
Right. I mean, even now to travel, a lot of places, if you're going internationally, you have to show that you have a negative COVID-19 test. With that, when we're talking about the testing, there was so much focus earlier in the pandemic because so many of the tests were not 100% reliable. Has it gotten better, the testing process, especially now that fewer people are getting tested?
So one of the biggest frustrations for us have been the rapid antigen tests and rapid antibody tests. And there were a lot of fly-by-night companies that were just using the panic of the pandemic to print money, to earn money. Those have sort of gone by the wayside now. And most of the tests that are out there and available that are being used and are being approved, frankly, by FDA are quite reliable.
That's good to know. I just heard a commercial, maybe it was on a podcast, about being able to do a COVID-19 test at home without doctors and without putting the big swab up your nose and getting the results back at home. It was almost like a, at-home COVID test, like a pregnancy test, right? So, and I'm wondering, are those accurate, or is it what you're saying, they're just trying to get your money?
No, I mean, there are some at-home tests that have been approved by FDA. I don't want to get very technical. I'll try. But
Thank you.
The accuracy of a test, oddly, is determined by your pre-test probability of having the disease or having the condition. And so, if you have 1,000 people that have not been exposed, have a very, very low probability of being infected with COVID-19 that are doing tests on themselves, you're going to see a large number of false positives. So the accuracy is going to depend on pre-test probability.
I was watching 60 Minutes last night, and they were talking about, some of these trials are still going on. There was one drug that was an antidepressant drug, I forget the name of it, that is now being used as part of the treatment for COVID-19. They're, still in the studies. How important is it for people to still volunteer for some of these studies?
Oh, it's crucial, because moving forward, there may be a fair number of people that we don't get vaccinated that do become infected with COVID-19, and we absolutely need treatments as well as preventives. So I think it's important that people continue to participate in trials. Absolutely.
Dr. Russell.
Let me also say, though, that our fatality rates have come way down, and it's because our hospitals have become so experienced and so incredibly good at treating and managing these patients when they do come into the hospital. They come into the hospital, they give them antiviral, they suppress the immune response so that they don't end up on a ventilator, they don't end up flooding their lungs. They're getting these people out of the hospital now. They're doing just a phenomenal job.
They really have been so many heroes on the front lines throughout this pandemic. Dr. Russell Faust with us here on the MegaCast. Just another minute or two with you here on the show. I had a friend who did get the first shot of the vaccine, but then a week later tested positive for COVID. How does that happen?
Well, getting vaccinated doesn't prevent you from being exposed. And unfortunately, there's quite a few people that think that once they're vaccinated, woohoo, they can go out and party and, be exposed. That is hang out with people without a mask, etc. And that's just not the case. Even if once you're fully vaccinated, we need to continue to mask and distance and avoid indoor gatherings of people. And there are many reasons for that, and we don't really have the time to go into all of them. But the fact is, there's still a lot we don't know. We don't know whether, even though you're fully vaccinated, whether you can carry the virus, be just superficially infected, not be symptomatic, but still transmit it. We just don't know that yet. We're gathering the data. We should know it soon. I'm expecting there to be changes in those quarantine policies from CDC soon. But even once you're vaccinated, don't just throw caution to the wind.
Dr. Russell Faust with us on the Oakland County MegaCast. He's the medical director at the Oakland County Health Division. Dr. Faust, with that, we've seen other states, particularly Texas, in the recent weeks, lift some of their mask mandates and mask orders on local levels and on state levels. What are your thoughts on those decisions as we are at a point where more people are getting vaccinated and we seem to be getting so close to being near the end of this? Is this too early, and what impact could those lifting of mask orders possibly have on this process of us getting out of this pandemic?
You're just pushing my buttons now.
Of course. I got to do it.
Yeah. So I believe there are 14 states now that have lifted some of these precautionary policies. And I think that's just absolute idiocy. I don't know how to put it more plainly than that. I mean, this is a marathon. It's not a sprint. We're nearing the finish line. It's not time to stop running. We really need to keep pushing. We need to remain vigilant until we put an end to this pandemic. And this kind of behavior is not going to do that.
Dr. Russell Faust with us. He's the medical director for Oakland County's Health Division. Dr. Faust, we always appreciate your time and also taking all of our questions and clarifying so much confusion that is out there. We appreciate it, but also we want to give you guys a big shout out. Your team has been doing an amazing job with some of these vaccination sites and working around the clock to make this happen. So we want to say thank you to you and your entire team as well.
Thank you very much. Yeah, my team is just outstanding.
Well, let's hope when this is over, you guys get a very well-deserved long vacation, and we don't go through another one for another 100 years. Dr. Russell Faust with us. He's the medical director for the Oakland County Health Division.